You want to get a tummy tuck done, but you're not sure how long does the recovery take. You're not sure when you'll be able to return to work, engage in social activities, and return back to a normal lifestyle. So in this video, I'm going to talk about the procedure and how long it actually takes in practical terms. Hello, my name is Dr. Arjun Handa, and I'm plastic surgeon at Handa Aesthetics Plastics. So let's just briefly review what is a tummy tuck. It is a procedure which involves taking out fat from your abdomen and your lower back, that is your tummy and your lower back, along with removal of loose excess skin. So we take the loose skin which is in the lower part of the abdomen, remove it, and take the upper skin and bring it down and suture it in the groin. And finally, we also tighten the tummy muscles. So we are removing the fat, we are removing the loose skin, and we are tightening the muscles. It's an extensive procedure which takes about 3 to 4 hours. And after that, it can be done as a daycare procedure, but sometimes it requires for you to stay in the hospital for a day. Now, normally the recovery goes something like this. You'll have swelling for a month. You'll have pain for about 7 to 10 days. You'll have to walk in a bent position for about 7 to 10 days because the tissues are tight. You'll have drains for about 5 to 6 days, which may be longer in case a lot of fluid is coming back. You'll also have to wear a compression garment for a month, which takes care of the swellings. You can resume activities after 6 weeks. Now, when I tell patients all of this, they have a bewildered look on their face because they don't know what it actually means in practical terms. So let's talk about practicality. Number one, 10 to 14 days, it's best not to engage into any work related activities or any social activities because you'll be walking in a bent position. You'll not be very comfortable. You'll have some pain for about 10 to 14 days. So I recommend my patients just take off for about 10 to 14 days, or if you're planning to travel, then 2 weeks should be a sufficient enough of time to recover and then travel. So first 10 to 14 days, just focus on the recovery, let the wounds heal and get back into a normal walking position. There is no bed rest during this period of time, but yes, you're walking inside the house, getting your own food, getting your own water, going to the toilet. But because of the pain, discomfort, and the drains for about 6 to 7 days, you're not really in a position to go out. So that's for the first 14 days. After that, you'll be able to go out, engage in social activities, get back to your work if it's a desk job or if it's an office job. If it's a field related activity, I would recommend waiting for another week. Finally, we talk about social recovery. So, what does that mean? So, if you're looking to attend events and you're looking to go on function, then we are talking about at least a month. Why? Because during that period of time, you'll have a lot of swelling. On the other hand, if you're planning to wear clothes which are not revealing, then you can go soon. But if you're planning to wear revealing clothes at these events, you want to look in a good shape, then I'll probably wait for about a month because there'll be a lot of swelling and people are going to ask that there is something wrong. After a month, you'll be able to wear whatever you want, but remember the body still doesn't look absolutely normal. So this brings us to the last form of recovery, that is the aesthetic recovery. So when is it that you can walk on a beach or you can wear your bikini or take your shirt off in case of males on the beach or at the swimming pool? So that can happen only after 2 to 3 months. Because although you've recovered completely, you're ready to go to work, you're ready to wear whatever you want, you don't have to wear a garment, your body still doesn't look normal and natural. It looks bruised, it looks swollen, it looks as if something has been done. To look absolutely normal and natural, at least 2 to 3 months is required depending from person to person. Finally, when are you able to return to rigorous physical activity, gym activities, outdoor trekking, and everything? That is usually reserved for 6 to 8 weeks. Why? Because we've tightened your tummy muscles and we do not want those sutures inside to give way and your tummy to become protruded again. We want those sutures to remain tight and nice so that the silhouette defined remains for a longer period of time. So it takes about 6 to 8 weeks for the muscles to get used to this tightness and for you to be able to return back to rigorous physical activity. So, in a nutshell, there are different types of recovery. One is work related recovery, which is just 2 weeks. Another one is social recovery, which is 3 weeks to 4 weeks, depending upon what kind of attire you want to wear. And finally, it's aesthetic recovery, which takes around 2 to 3 months.